Hi, everyone. My name is Emily Guzman. I am the president of the East Elementary School PTO for the 2021-2022 school year. We are very pleased, along with the other PTOs of Morrison Gordon Elementary School and the Plains Intermediate School, to present you with this recorded presentation from our COVID vaccine panel. The beginning of the recording is cut off, so I just want to give a little introduction to our panelists. We had on the right in the striped sweater, we had Katie Fleming. She's an RN who works with community health programs at Ohio University. Then we had Dr. Lance Broy, who is a family medicine physician at Holzer Health System. We had Dr. Gaskell, who is the health commissioner of the Athens City County Health Department. And then finally, we had Dr. Karen Montgomery Reagan, who is a pediatrician with Ohio Health over in Parks Hall. Thank you for taking the time to watch this video, and I hope that you will find it helpful.
For at least 20 years, I started in 2002 when SARS arrived on the scene. SARS was supposed to be a terrible pandemic. It came out of China. Bats infected civets, which is a small rabbit-like mammal, which was used to feed the Chinese. And they thought it was going to be a large pandemic. So they started working on a vaccine. Turned out to only infect 25,000 people because it wasn't a very contagious organism. It was a coronavirus. It was a novel coronavirus, somewhat like what we have today, but it was not contagious. It had about a 5% mortality, so that was serious. And it was a respiratory illness like the disease we have today. But they started working on the science to produce a vaccine. And they, if you will, dabbled in the science over the next 20 years until this coronavirus appeared on the scene. In the meantime, they learned a lot about the science of messenger RNA vaccines, and they had hoped to produce a vaccine for influenza, messenger RNA for influenza, maybe anthrax, smallpox, Ebola. They had a variety of diseases that they were hoping to produce messenger RNA vaccines for, but they never quite did it. But with they were on the cusp of doing it, and when this coronavirus came along, it got done because of actually the government's large investment in money into the science and the number of people, I think, that they got to help them, and somehow magically it appeared in a very short period of time. And we actually, we should be grateful that our scientists were able to come up with a vaccine this quickly for this terrible, contagious pandemic.
Dr. Gaskell, or anyone really, could you talk a little bit about what makes this vaccine different from other required vaccines for children?
Well, you know, the other vaccines for children have been around for a long time. And they prevent common viral illnesses that we're all familiar with. Viral illnesses that have been here for decades. Measles, mumps, German measles, chickenpox, really common diseases. And so about polio, whenever we develop vaccines for those, the public seemed to be grateful. They were pleased that we had a vaccine now that could rid us of these infectious diseases that really were, although not considered serious frequently, they often had serious consequences. Measles, about 1 in 1,000 kids that got measles encephalitis, and a lot of those kids with measles encephalitis died. And occasionally a kid would get chickenpox and have a chickenpox encephalitis, an ataxic kind of encephalitis. So that happened. So there were problems with it, but the common childhood illnesses did not have a reputation for being very serious. So when vaccines came on, people were grateful, but their attitude was a little bit different than today. I must say, though, as we introduced those vaccines, it took a little while for people to embrace them. By a little while, I mean a month or 2 months or 6 weeks. They waited till their neighbors' kids got the vaccine to make sure it was okay, and then they began to come and get vaccinated. So it wasn't immediate embracement of vaccines, the childhood vaccines. It took a little while. This one is different. This vaccine has been politicized. I hate to say it, it's been politicized. They haven't They haven't just accepted what the scientists have to say. They've believed some of the politicians. And as a result, they haven't entirely accepted this coronavirus vaccine. It's been introduced in a different way, partly because it was a pandemic, partly because people were dying and we needed a vaccine rapidly. And all the deaths got widely publicized too. So there's a lot of emotion associated with this vaccine, as opposed to the other vaccines as they came along. So this is much different than anything I've ever experienced. And of course, it's a new virus to us too. We have never seen a virus like this. I like to say about the pandemic, it's predictably unpredictable, because about the time we settle in and think we know something, the CDC comes along with some new science and changes it a bit for us. Not entirely, just a little change, just enough to, upset the public. And the public then thinks, well, CDC may not really know what they're doing. And they do, because the public often doesn't understand how science works. That change is going to occur when you are accomplishing scientific. So we're not surprised, but it's hard for the public.
And further on the vaccines that we've given to our children, let's think about all the times I got asked about there's a chickenpox party down the street. And because that families were very, very lucky that they didn't have side effects, that they got the immunity from getting an antibody. And so it was hard for them to believe to go ahead and get that vaccine because chickenpox didn't hurt them in the long run, and those parents already had chickenpox. But they don't understand some of the effects we have seen with true chickenpox, like Dr. Gaskell said, the encephalitises that are seen with just regular chickenpox, but everything can have a degree of severity. There's also vaccines now with Haemophilus, and strep pneumococcal. Prevnar, you all know. Those are bacterial. And so I have been doing this for a while to the point that as a resident, I saw those meningitises from those two bacterias, and I saw what they did to devastate those children or possibly lose them. And now as I teach still, I don't have residents that even have to think about diagnosing this could be a Haemophilus meningitis. Most meningitises nowadays are just a mild viral meningitis per se. And so that is something else that families are not devastated with getting that type of meningitis because of our vaccines.
So related to that, there's been a lot, the time frame testing this vaccine has been a lot shorter than a vaccine that is fully approved and that we have years of data on. Why should parents trust this vaccine when it's so new?
Yeah, these vaccines have been produced under emergency use authorization. There haven't been any steps skipped. The steps have been compressed into a shorter time frame because people were dying. So they moved everything forward. And actually, it will fully authorize the vaccines after they've been out for about 6 months. And as a result, one of the vaccines was fully authorized recently. It was the Pfizer vaccine was fully authorized. So that one passed mustered over a 6-month period of time, and it was fully approved. We need to keep in mind that indeed, almost all the serious complications of vaccines occur within 6 months of their release. They don't occur 3 or 4 years down the road. They usually occur very rapidly. Within 6 months, you're having problems. And that's true because of our very robust VIRS reporting system. We have a vaccine adverse event reporting system in the United States where the patient can report, the doctor can report, the clinic can report, the nurse can report, everybody can report the VIRS. And then they analyze those VIRS reports and discover whether there's anything worthwhile. Now, they're not very interested in a sore arm after a vaccine, but they are interested in somebody that has a coagulation problem and a clot. And we experienced that with Johnson & Johnson, and the vaccine was put on hold for a week and wasn't administered until they realized that the incidence was 1 in 900,000. Very low incidence of disease. It affected actually primarily a group of people, primarily young women, who were affected by the J&J vaccine. And then the myocarditis was discovered in primarily older adolescents. That was associated with the messenger RNA vaccines. Pfizer first reported it, and Moderna came along and had it also. And we could talk for a long time about the myocarditis, but that was discovered as a result of years reporting. Mm-hmm. And the incidence is very low, 2 in 100,000, not very common, easily treatable, etc. But we have a reporting system to discover these very rare and unusual events in the United States. So it works effectively. And almost all the serious problems are discerned within 6 months of release of the vaccine.
I have a note on VAERS reporting. Because I'm a nurse and I have to do a lot more research to understand things, I don't have the medical training. So I've had a lot of people come to me and say, but I've seen on the VAERS reports that it's causing this and it's causing this and it's causing this. And I think it's important to note and explain to people that, like you said, anyone can report to VAERS. As a patient, you can report, doctors, friends, family members, anybody can report to VAERS. And the incidence of report doesn't necessarily mean that it actually correlates to the vaccine. Is that correct?
That's true. And the people at the CDC have to analyze these reports and decide whether they are a meaningful problem. And I suspect that there are a number of people that report particularly after a Moderna vaccine, which has a lot of antigen, has about 100 micrograms of messenger RNA, they get fever and achiness, and 8% of them will miss a day's work. So after Moderna, the second shot particularly, they really felt bad. So probably there were some VIRS reports generated from that. Yes. And people at the CDC said, well, that happens a lot with the VIRS, with the Moderna, because they have a lot of messenger RNA. Right. And, so they sort of dismissed that. They're looking for, sort of serious things. Yes. So if you look at the VIRS reports, it's thousands of them generated. But they're all serious issues.
Yeah. And it is ran through like an epidemiology report. So they run that information through, correlation. How many of these typically happen, in day-to-day living versus what we're seeing reported. And that's how they come up with that. Is that correct as well?
That's exactly right.
That helped me to be able to understand when I was looking up VAERS reports and explaining to people a little bit more.
So people are obviously concerned about possible side effects of the vaccine. So I'm getting a few other questions coming through that are along the same lines. Dr. Gaskell, you mentioned that most serious reactions occur within 6 months of getting the vaccine. Why was the EUA granted when the children were followed for a significantly shorter period of time?
Well, I think they granted emergency use authorization for all these vaccines because people were dying. And they were trying to bring a halt to that as rapidly as they could. So they didn't want to wait a year. Often it's a year or 2 years before the vaccine is released. But in this situation, this was true emergency use authorization. Truly an emergency. So many people were dying. And so they were willing to grant authorization based on the information they had available. And we have to remember that they had trials for all these vaccines. Moderna administered the vaccine to 40,000 people, Pfizer, 30,000 people. That's a lot of people. And they followed their course over not as long a period of time as many people would have wished, but certainly for months, for 4 to 6 months before the vaccine was released. We didn't get a vaccine as quickly as a lot of us would have liked to, but we had to wait. And I remember we had at our disposal to try to manage this pandemic. We had some tools, but we didn't have a lot of tools. We had hand washing, we had masking, we had social distancing, we had isolation and quarantine, identification of people who were really sick, and we isolated them, and we quarantined their contacts. All those were public health measures that helped, but they weren't nearly as effective as a vaccine. They were helpful, and those were times that we really struggled for a long time. For about a year, we were anxious to get a vaccine, and then finally vaccines arrived on the scene, and they have made a huge difference. One of the big problems we've had, though, darn Delta variant came along, that all of us witnessed this decrease in infection rate. Last summer, we were down to a few cases a month, and we thought we were home free. Everybody had predicted vaccines were going to work, and they didn't work. But the Delta variant came along, and that made things much more difficult. We had a surge in the
Perhaps while we're talking about side effects of the vaccine, and for any of you, can any of you, particularly if you've seen COVID patients, can you talk about the typical effects we see when a child is infected with COVID and what the negative secondary and longer term responses to that might be, so we have that contrast?
I don't practice pediatrics anymore. I'm a public health person, so I'm relying on my colleagues.
Sure. What do you want to start?
Okay.
So what I see in the office, and I do have a case or two that I was kind of taken back, because obviously children come in and they don't look ill. They're running around, they have a runny nose, they have a cough, and they have a fever. Okay. And so those children may be a fever not even as long as 24 hours. And there's no known exposure that they know of. And I will go ahead and question, parents will go through questions, and there's no known exposure, but in the tracing, I get a little bit curious. And there were 2 children running around in that office, looked healthy as all get out because they had no further fever. And what do you got? COVID positive in both of those children in 48 hours. I would have lost on that bet, okay? But you follow your criteria, and we did it. Now, long-term effects, it depends on the severity, I feel. And I'm trying to find that slide right now there's some literature that says up to about 12 weeks or so, you can have a cough, you can have some achiness, you can have fatigue. And I think the big thing is the fatigue. There can be some mental health scenarios with it. I'm trying to think of my list. The mental health, what else?
Occasionally they have something called multi-systemic inflammatory disease.
Yeah, that one, yeah.
ISC. It's pretty rare, really rare, but it's a serious disease. It's like Kawasaki's disease.
Yes.
It's really worrisome.
And what Dr. Gaskell's mentioning is that multi-system inflammatory disease, that syndrome they've called. That one can occurs within 2 to 6 weeks after. And it does have a wide range of complications. 60 to 70% of the children that do get that end up in intensive care, and 1 to 2% end up dying. How many cases I happen to have here since October is 5,200 of that. So how common is that? It's very rare. It says incidence is 100 to 600 cases per million of SARS positive infections. So that's approximately 100 to 600 cases per million of positive.
Karen, I can share that slide real quick. If you
Okay,
like.
yeah.
Yeah, so we have this PowerPoint from the CDC that has some of the statistics that Karen's been sharing with you here. So I'm going to share that, hopefully, on my screen. Yes. So this is what they were just talking about, the multi-inflammatory syndrome in children with these very high hospitalization rates. Not happening super, super often, as they said, but very, very, very severe when it does happen. Anything you want to add there?
Go up 2 slides, 16. COVID-19 deaths by age group, January of 2020, 5 to 11-year-olds. So right there we have 90, you see that age group, and this is where the black says 5 to 11. So 1.7% of all deaths among children 5 to 11 years of age. I know that number sounds little, but if it were my child, if it was your child, that would be devastating. And, you know, the vaccine really outweighs the risk of adverse effects of what the possibility of your child having COVID. And yes, you're going to say, we're a healthy family. We don't have any problems. So my child will do fine if they get COVID. But do you really know that? The children that I had experience with varicella, they thought the same thing. Everybody gets chickenpox, and then this child gets encephalitis. So complications with just about any vaccine, there can be anything, but what do we do here? We need to see how we can help you feel a little more confident about these vaccines.
Well, the Delta variant has really affected our children much more seriously than the original. We'll call that the alpha disease. The kids weren't very sick, and there weren't very many of them infected. But this one is much more contagious and much more virulent. At one time this summer, our children's hospitals were full of respiratory syncytial virus and COVID. Seriously ill kids that we hadn't seen before with the original virus. This Delta virus is a different, more aggressive virus. And the kids have suffered greatly from this. Our children's hospitals were full for a while. And of course, the sicker they are, the more likely they are to get multi-system inflammatory disease in children. The more likely they are to get cardiac disease too. You know, we mentioned myocarditis. You're 7 times as likely to get myocarditis or some sort of cardiac issue with the disease than you are from the vaccine. You know, the myocarditis associated with the vaccine was sensationalized a bit. There are not huge numbers of kids reported with the myocarditis. I think there were 877 children reported by VIERS, and that they had to fulfill the CDC criteria, so they were a little bit more rigid. But that's not a lot of cases. About 2 cases per 100,000. So myocarditis is relatively uncommon. We might as well talk about it a little bit. They respond really well to steroids, and there's only been 1 death in our aware of. So it's very rare. And easily treatable with steroids, and the kids get better within about 5 days. I think we had this conversation off camera. If they treat them with steroids, they get better in about 5 days. Their symptoms are chest pain, they're short of breath, and they have palpitations, so they're fairly easily recognizable because of their chest pain. They were getting hospitalized, all of them were, for a while. I have a feeling because they respond so nicely to steroids, they don't get hospitalized now. I imagine many of their physicians follow them as an outpatient daily and start to find steroids properly and recognize the syndrome. And so I don't mean to denigrate the syndrome, but it's by and large not real serious. There's only been 1 death I know of in New Zealand. The kids respond very nicely to anti-inflammatories. They get better fast. They're easily diagnosed because their symptomatology. And again, it's pretty rare. 7 times as likely to get it from the disease as from the vaccine.
So I just want to clarify, you're saying COVID itself could also cause myocarditis?
Oh,
Yes, indeed.
7 times.
7 times as often. Yeah, you know, while we're talking about vaccine versus vaccine versus illness, we need to make a case for recognizing that the people in the hospital today, the adults in the hospital today, are likely to be unvaccinated. And the ones that die are likely to be unvaccinated. So, so this is going to apply to the children, because the children are affected from the Delta variant. That's why we're grateful that now we have the vaccine to give to the little kids. They can get infected and can spread it. And so we're grateful, really. Now we have a vehicle to prevent that from happening.
So we have some questions that are kind of clustering together around the same theme, this idea of natural immunity. Do you think that that natural immunity is stronger than vaccine-induced immunity?
No, from what I've read, the effectiveness of the vaccine, the messenger RNA vaccines, which Johnson & Johnson is not, just to clarify, have shown very strong immunity. True, if you have had the illness and you get vaccinated, then that's sort of the mega immunity. But I wouldn't say that natural immunity is necessarily stronger than the vaccine.
It inflames, doesn't it?
It
Well,
does.
all of it.
They all,
wanes.
yeah. So if a child has already had COVID, do they still need to get the vaccine?
Absolutely.
Yes,
Absolutely.
absolutely.
How long after they have COVID should they wait before they get the vaccine? So they heal, all their COVID symptoms are gone. How long should they wait to get the vaccine?
CDC says once you've finished your isolation for your disease, you're eligible to get the vaccine. So the isolation period is 10 days. So after 10 days, you can go ahead and get the vaccine.
What about other vaccines? So I know at this time of year, everybody's thinking about flu shots. Should there be a gap between receiving a flu shot and receiving a COVID vaccine, or is it okay to get them at the same time?
Absolutely okay to get them at the same time.
CDC says yes, you can get them at the same time. And you can get your other childhood vaccines too. Think of the number of antigens we give a kid.
At any one moment.
At some of those visits, lots of antigens, maybe 5 or 6 antigens. And here we're just talking about 2, flu shot and possibly a coronavirus vaccine at the same time.
You can get them on the same day, you get them a few days apart, a month apart, but there's no reason you can't just get them on the same day, and that would be recommended because we're right in the midst of the season.
Look at that. So what if a child, so I know we talked about if they had COVID, they can get vaccinated as soon as their isolation is over. What if they've had the flu or a stomach virus or some other, I know hand, foot, and mouth was going around. What if they've had something else? Should they wait any period of time?
I mean, my standard practice, the only major absolute contraindication is if they have a current fever or they are a little bit more severely ill. But if they are having a cold or a viral infection and they're doing pretty well, I sometimes will wait for them to get over that illness. But if they don't have a fever above 100.5, I typically would go ahead and vaccinate them.
Yeah, I agree with that too. We look at kids all the time and we can tell that do they look sickly or do they not? And I go with fever also. I will go ahead and also give a vaccine really up to 101 actually. But and I don't hesitate if they got diarrhea, if they've had some vomiting, any of that, as long as also they don't look very ill, okay? There's a limitation to what every virus can do. And so that child is running around and saying, I don't want to have those vaccines today. Well, then they're probably okay to get that vaccine today. What about?
I haven't practiced pediatrics for a long time, but I certainly agree with them. that hasn't changed.
All right.
that hasn't changed.
What about children who are very small or more, so like a 5-year-old who is more the size of a 3-year-old, or an 11-year-old who's more the size of a 14-year-old? Should they still get this 5 to 11 dose, or should they be considering something different?
It's called immunological maturity.
Yeah,
Even though the size, there's a difference in their size, their immune system is still very similar. An 11-year-old, you know, a 50-pound 11-year-old compared to an 80-pound 11-year-old, or 100-pound 11-year-old, they're going to have pretty much the same immune system. So they have immunological maturity, so they should be treated the same.
not based on the size or weight, it's based on their immune system.
And actually, their immune systems are stronger. So the reason that it is a lower dose is because they have a more robust response. And the original studies were done with the same dose, 30 micrograms, 20 and 10, and they found that they got the same bang for their buck with the 10. So no reason to give them more than what they need. So because their immune systems are actually more robust than adults, they get a lower dose and get the same effect.
And are we seeing any differences in side effects? Great. I have a couple questions from children who are in the chat today, and I want to make sure that those get answered.
Awesome.
So our first child from a question, what does this shot feel like?
I give a lot of those. And I just got my booster. So I can answer if you don't mind
Go for
for
it.
at least one. It actually is a very quick and it isn't in the actual liquid goes into your arm.
People say to me they didn't even notice it happened.
Yeah.
It happened so fast. And
Yeah.
it's done already. And I must say, the volume that the young people, it's not very much at all. It's just a little bit. So I think that'll help too.
I'm not sure about the age group of the person, but if they've gotten an HPV vaccine or a tetanus vaccine, sometimes they have a little bit more of an owie reaction from that than they will from this. It is a smaller amount. And there's not a lot of achiness afterwards. Of course, you need to use that arm because if you don't use it and you baby it, then therefore it may start to hurt a little bit. But otherwise, I too had mine, and you didn't even know it went in. There's no stinging. The medicine doesn't do any stinging or anything of that nature. There wasn't any swelling. All went very smoothly.
So what kind of side effects might a child expect to feel after they receive the shot?
What did you say? Side effects?
Side effects after they receive the shot. How might they expect to feel that day, the next day?
So they're all different. For a child, I guess fatigue is the biggest. I think fatigue, maybe a low-grade headache, sometimes chills, but it just depends on your immune system, how your body's going to attack. They also say, though, those are good signs that you having a side effect like fatigue a little bit or a chill, because that means your immune system is really kicking in and doing what it's supposed to do. Now, if you don't have that sign, that's okay too, because you're still going to have benefit. But do I see literature about a swollen arm? Do I see redness? No. But I hear fatigue. Fatigue is the biggie. Headaches, some chills, some maybe a little nausea, I think. Any others, Dr. Gaskell, Dr. Roy?
I think mostly muscle weakness. Some of them feel that for a day or two. As a matter of fact, in the trials for the little kids, younger kids, the 5 to 11-year-olds, 68% of them had some mild symptom after their vaccine for a day or two, like a little fever, a little muscle aches, just not feeling quite as energetic and busy as they often are.
Right.
They're a little slowed down for a day or two. So it's pretty common, but it's not very serious, and probably a little Tylenol or Motrin will be all they need.
And again, that's their immune system revving up to the shot. But even if they don't have that, doesn't mean it's not working, and a lot better than 2 + 12 weeks of illness comparatively.
So another child would like to know if they have to get 1 shot or 2.
2 shots,
2 shots.
3 weeks apart.
And then another couple of weeks to develop immunity. So it's a 5-week process. You get one, 3 weeks later, you get another one. And it's 2 weeks till you're fully immunized and you have antibodies. So it's sort of a 5-week process.
So children who are immunized at the health department clinic this Friday would have their second, so on the 12th, would have their second dose on December 3rd.
Yes, exactly.
And then 2 weeks after that could expect to be
Fully immunized.
They'll be fully immunized before Christmas.
before Christmas.
About 90% immune.
Are they going to, at your mass clinics over there, like, are you going to get them scheduled again then for
Yes.
December the 3rd when it happens? Okay,
And we'll go back to that.
okay.
We
And
have
you'll go-
those mass vax clinics at Heritage College.
Yes.
Boy, it's a wonderful place to give vaccine. It's just terrific. We can move a lot. You've seen it. Yeah, we can move a lot of people
Well-oiled
through
system.
there efficiently. And we can then separate them to observe them for their 15 minutes of observation pretty easily too. So it's just ideal. And we like going there. But yeah, we'll schedule them for another one. And apparently we have Fridays available to us because medical students aren't there. But we're really grateful for that location. I often say to them, it's not only the best location in town, it's probably the best location in the state. It might be the best location in the country.
So I want to ask some more about how those clinics will function, but before I get to that, this is a really important question I don't want to forget. If a child has allergies, including an egg allergy, possibly many allergies, what should parents consider?
Well, we'll vaccinate them so long as they haven't had an anaphylactic reaction to the vaccine. We'll vaccinate them if they've had hives, if they've had other allergies. We don't observe them a little longer. The usual observation period is 15 minutes. For somebody who's had hives or other allergic manifestations, we observe them for 30 minutes. We have EpiPens, if you will, epinephrine to treat an acute allergic reaction. We've seen 2 cases of 2 adults with anaphylaxis. It's reported that the incidence is 1 in 15,000 doses. Our experience is 1 in 10,000 doses. So we've given about 20,000 doses of COVID vaccine, and we've seen 2 episodes of anaphylaxis. One was clear, the other was maybe. I was the person trying to decide that even after I gave the epi and they said they felt better, I still was a little uncertain. It was the beginning of an anaphylactic reaction. You don't want to wait until it's full blown. So
But the obvious one was treated and did fine.
did fine.
So and then
it's
also
really
just
rare.
wanted to clarify, there is no egg in these
Yeah.
vaccines.
There's no egg, no latex. There isn't anything like this in any of those. That there's a list that I can't find right now, but anyhow, yeah, the egg thing, not to worry. Latex, not to worry. Really clean.
And I,
Yeah.
if you guys know better than I do, when I've been giving the vaccines and the Pfizer vaccine, they say that the only known contraindication is that if you have a true anaphylactic reaction to PEG, polyethylene glycol. That's the only one that if you actually have that allergy to polyethylene glycol, that would be the only reason to not get this vaccine for allergy reasons. Is that correct still?
That's still correct.
And I am dropping a couple links in the chat that send us to some more information about the vaccine itself so that parents can pull that link out of the chat and go check out the whole thing from the CDC. So can you tell us a little bit more about how the clinics will work at Heritage Hall? So a lot of parents got their vaccine. As you said, Dr. Gaskell, you've given tens of thousands. A lot of parents got their vaccine at Heritage Hall. Should they expect it to be similar to what it was for them?
Yes, they'll come in the front door on the right, check their paperwork to make sure that they have a permission slip, walk down the hall, go to the room that we call the slab, which is a cement floor, get their vaccine, come down the hall on the other side, and then come into the waiting room, which is in the atrium, and be seated to be observed for 15 minutes. So it'll be exactly the same way. If the child is seriously unhappy and resistant to our efforts, we might find a private room. We have a couple of private rooms, and we're going to have nurses manning those rooms. So we're going to have 5 stations. We're going to have a couple of private rooms for those kids who are not very happy. And we have, luckily, we have some child life university students coming to help man that clinic. 13 of them, as a matter of fact.
That's wonderful.
And they're going to help with the children. And they're going to have puppets and toys and a variety of things to make it easier for them.
Nice.
We even talked about dogs, but that might get a little bit more complicated. The dogs would have to pass some sort of test, I suspect.
So what I'm hearing is it's going to be a little more kid-friendly, probably, than the adult clinics were.
I hope so.
So if a parent anticipates that their child will be a little more upset, should they bring that up right when they come in?
Yes, let us know. And we'll probably move them to a private room where they don't join all the other children getting vaccinated down in the main vaccination room. There will be 3 nurses in the main vaccination room like previously. And, children will come in order. And they will have 2 other places where they can go. And if the parent anticipates that they'll be very difficult, then we'll just move them immediately to those locations.
Okay. Could children bring anything with them? Like if they have, my daughter has a stuffed dog that she takes whenever she expects to be upset about something. Could they bring a comfort object?
Sure.
How about, could a parent occupy their child with a phone?
With the what?
A cell phone. Could they play a game?
Oh, sure, that's fine. Yeah.
Okay. Great. One more link coming up in the chat. This is a Pfizer fact sheet about ingredients and what is also not included in the vaccine.
Polyethylene glycol, I have a sheet in front of me. It's in the Pfizer and the Moderna. It's in
Yes.
both of them.
Yes.
So it's pretty common.
Yep.
It's a good question to ask
Mhm.
when they appear for a vaccine.
Mhm.
So there has been some information, we're getting back to skepticism a little bit about the ingredients in the vaccine. There's been some information that some of the ingredients have been changed since some of the original testing, and some of the maybe inactive ingredients in the vaccine have been changed. Is that accurate?
I haven't heard that. I'm unfamiliar with that.
People have also read that there is something in the vaccine that would stabilize people suffering from a heart attack. No, none of that either.
I've not heard any such thing in the medical literature.
And certainly, there's no evidence that the vaccine causes sterility. That's another issue that's been brought up. In the Pfizer trials, 23 women got pregnant. So, no, not likely.
Can anybody comment on Antibody dependent enhancement, and whether that might be something we might need to worry about several years down the line after a vaccine. Could antibody dependent enhancement happen if someone were exposed to COVID in 3 years?
Yeah, that was brought up to me early in the pandemic, and I looked into that. I wanted to see what the FDA had to say about that, what the CDC. They didn't think the literature supported that. They didn't think that the studies that suggested that phenomena had been vetted, and most of the places that those papers appeared were not, they weren't journals like the American Medical Association, American Academy of Pediatrics, the most New England Journal of Medicine, British Medical Journal. They were less well-known publications, I'd say.
Do you have any concerns about any of the ingredients in the vaccine or any long-term effects of the vaccine?
No.
Back to practical questions. I know this is something that has been very important to my daughter as she gets older. Will a very young child be able to receive the vaccine in their thigh, as they often do with their young child vaccinations?
Will the very young children be able to get the vaccine?
Or very small children, will they be able to receive it in their thigh rather than their arm?
Oh, sure. Oh, sure.
Oh,
Oh, yeah. I mean, you know, pediatricians, family doctors, they all give vaccines in thighs.
Yep.
It's a big muscle.
Yes, it is. So if a child wants to, or if a parent would like for them to have it in their thigh, that can be arranged. Great. We are running low on questions. If anybody in the audience has anything else they would like to ask, this is your time. I'm just gonna pose to all of you. Katie, is there anything as a parent that you've had on your mind that you'd like to share?
I guess I really am I call myself a research nerd. So I research a lot of things and I look everything up before I do it. It's just part of my personality. But I would just want people to understand that having questions and having fears is okay. You just have to find reliable, factual, educational information to help support your decision. Myself included, I have what I've gotten emotional trauma from social media. You know, like, and it's a real thing. Every day you get on social media, you watch the news, you hear your neighbors talking about it, and it is inciting panic and fear into people by spreading misinformation. I know so many of my friends and family members have asked me, are you really going to vaccinate your kids and cause them to be infertile? And that weighs heavy on my heart. It does, because no, I don't want to hurt my kids, but the research just simply doesn't support that there is any evidence that it will do that. So I just want you guys, anybody who's out there watching who's a mom or a dad or a parent of any kind, your fears and worries are validated, and I understand that. But just make sure that you're getting factual information from the right people, because I understand how hard it is to filter out everything else that's going on. And even though you know it might not be true, it's in your brain, you hear it and it makes you worry, you know?
Sure.
And I think that especially for lay people who don't understand the medical world, who don't understand how to read the literature and make sense of it, it's a really hard thing. It just is. So good for you guys for watching and trying to learn a little bit more.
That's right. Okay.
Maybe I missed it, but the clinic on Friday, is it just come all first come,
No,
first
no,
served?
actually,
Scheduling
we
it
try
up?
to separate them. Go to gettheshot.coronavirus.ohio.gov. Gettheshot.coronavirus.ohio.gov. And you come to our site, you have to work your way through the program, but come to our site and you can schedule a time there.
Okay.
So that we don't have everybody arriving at the same time. It's hard to keep people separate.
How many doses has the health department been allocated?
Oh, we've got plenty of vaccine.
Plenty of vaccine.
We've got enough vaccine to vaccinate everybody. We're not going to run out of that. You know, that was early on. That was a problem. We didn't have enough vaccine. We were sort of rationing vaccine. Everyone wanted vaccine. We didn't have enough.
Well, I meant with the
Now we have.
pediatric vaccine, because I know you can't just take a third of the
No,
adult vials, so you got
No,
enough of the
it's-
vials with pediatric vaccine.
it's a completely
Right.
different, but we have lots of vaccines.
Okay.
Yeah.
No, to what Katie said, I mean, kind of spinning off of that, I understand those, we have our wait and see people. And I mean, I know the pediatric vaccine is a little different, but it's really not. It's the Pfizer vaccine in a smaller dose. And we have now given millions of doses across the US and billions across the world. And so it has proven itself. I understand it was a little rushed. The saying, desperate times call for desperate measures. That's where we were. We were literally in a war. And so we had to do what we had to do. But now the vaccine has been proven bar none. Its safety, its effectiveness, it's the only option we have. Like Dr. Gaskell said, we had masking and social distancing and washing our hands, which we should continue to do all the time. But now with this vaccine, we have a way to potentially end this pandemic. But we have to all be in it together.
I understand that arriving at the truth sometimes is very difficult, particularly when you're dealing with scientific information. We all have troubles sometimes of discerning what the truth is. But in this situation, there's an abundance of information. And as you look at all the information, the safety of the vaccine becomes increasingly apparent. The vaccines are safe. The vaccines we have available to us have been given to absolute millions of people. And surely, if there are going to be serious problems, we would know by now. So I think it's important to continue to look at the data. I think it's important for people, if they are hesitant, to talk to their physicians. That's somebody that they know and trust. And they should talk to their own physician and get their physician's opinion regarding the vaccines. But this is an opportunity for us to bring this pandemic to an end. And this is our best opportunity, is to vaccinate as many people as possible, including the little kids, who can be a source of spread. And they can also get very sick. Previously, they weren't going to get very sick. They were just going to spread. Now they can get very sick. So there are more reasons to be sure and vaccinate them than previously. So vaccines are safe. This is our way out. So now is the time to act.
Hashtag get your shot.
Get your shot. Get the shot.
Dr. Reagan, do you have a?
Well, I was also going to say, yes, with this Delta, the children seem to be a little more ill, but we also have to remember they love their grandparents, and I'm hoping all grandparents have been vaccinated, but still there's that possibility that they themselves can take it to someone else, even though they may not be so ill. They could take it to someone else, and then that person is the one that's getting the side effects from something severe with getting the infection. So if our children get protected, then it's going to protect that family lineage out there for the older individuals per se, or the immunocompromised family member that you have in the family actually.
So as Dr. Gaskell was saying, the health department has this clinic scheduled this Friday, and then there are many others scheduled as well, right?
And we're going to have another one the following Friday.
Great.
We've opened that up, and we're starting to get appointments for that clinic too. And we'll be going to all the grade schools. It'll take us a little while to work through them. But we have some experience. We did H1N1 10 years ago and vaccinated 78% of the children in Athens County. So our nurses have experience, and we'll find our way to all the grade schools. You might be there too.
Yeah.
To my knowledge, Holzer, the initial allocation for pediatric doses has been 900 divided across our system. So only some of those are coming to Athens, but we are as well starting to vaccinate Holzer patients, Holzer established patients at Holzer Athens on Friday. That will be our first day as well. That will be. So if there's Holzer established patients on the call, they could possibly go there as well Friday. Call, make an appointment there.
And anyone can go to that Get the Shot website and see all available
Yep.
clinics there.
In addition, the Heritage College of Osteopathic Medicine, the community health programs, our vaccination program, we have been allocated at this point, we've ordered 300 pediatric doses, and we'll be also doing vaccination clinics. So, and that can also be found on the same website. So, and we also love to help the health department. So, you know, familiar faces, it's nice to have familiar faces and people that you trust, so.
There are 3,500 kids, age 5 to 11 in Athens County, so we're going to be busy.
Do it, yeah.
It's a lot of
We're not
vaccines.
going to be competing with each
No,
other. We're
because-
going to be helping each other.
Exactly.
Yeah, there's a lot of kids.
Exactly.
I hope we're busy. Yep.
Too.
Bring it on.
Well, questions have stopped. We have a lot of comments thanking you all for taking your time to do this, to answer questions for parents and the children who came. I am so grateful that you all took your time to do this. Audience and people who are not here but wanted to watch, we have been recording this session and we will be sharing it. That might take a little bit of time to do the logistics, but it will be shared. It will be available for people who weren't able to make it tonight but wanted to be able to watch. All right.
Thank you.
Thank
Thank you, everyone.
Thank you,
Thank you.
everyone.
I never get to see you.